All right, Gene, can you hear me all right?
I can hear you great, Dan.
And can you see the screen okay?
The screen looks great too.
Okay. Well, I'd like to welcome everyone to tonight's webinar. As you can see by the opening slide, we're going to talk about how to reduce the risk for Alzheimer's disease and improve cognitive function. Emerging science has shown a significant link between Alzheimer's and cardiovascular disease. And while cardiovascular disease is the #1 killer of men and women worldwide, Alzheimer's disease has become the #1 fear of the baby boomer generation. Why? For two specific reasons. First, we've had to care for loved ones who have slowly lost their mental clarity. And in our care for them, we have directly experienced the emotional, financial, social, and physical costs this disease has had in fragmenting loving relationships. Second, we don't want to personally experience the loss of cognitive function and become a burden to our families. The other sad reality is that currently there is no known cure for Alzheimer's. Once you have it, it's a progressively disabling disease that will result in death. Pretty depressing until you understand the following. The cure lies in prevention. That's right, you have the power to make a significant difference in how this disease affects you as well as the people around you. There is enough research and clinical data to positively demonstrate that if you properly care for your cardiovascular system, you will substantially reduce your risk for Alzheimer's and many other diseases. Now, before I go any farther, let me introduce myself and take care of a few housekeeping items. My name is Dan Hammer, and I want to thank you for joining our health webinar. I'm part of a team whose mission is to help save 1 million lives, and that mission starts with you and your loved ones. Over the last several weeks, we've looked at the health issues of high blood pressure, cholesterol concerns, and the cardiovascular complications associated with diabetes. Just like in those webinars, the information I share with you tonight will be accurate and factual so that it conforms with FTC policies. Also, this webinar is for general information purposes only and should never be used as a substitute for professional medical advice or medical examination. And this information has not been evaluated by the Food and Drug Administration, so it shouldn't be used to diagnose, treat, cure, or prevent any disease without the supervision of a qualified medical professional. Here are the remaining topics for our Tuesday night health webinar series. I've already introduced tonight's topic. We'll be changing gears next week by looking at athletic performance. It doesn't matter if you're a recreational weekend warrior or a highly trained athlete. I'll show you a simple way to take your workouts, performance, and recovery to a higher level to help you achieve even better results. Then we'll explore the area of weight loss and finish up this series of live webinars with sexual health, which for many men is really a reflection of the health of their cardiovascular system. This slide brings me to my final housekeeping item. The picture of the pretty lady is Jean LaValle. We're working together to make sure this webinar series is possible. So Jean is taking care of the technical issues, so if you really want to be connected, make sure that you send Jean your email address so that she can put you on our email list. This will allow her to send you a direct invite. And if anyone has any questions on tonight's presentation, then please type them in the control box in your upper right-hand corner of your screen. Jean will monitor these questions and will try to address them at the end of the webinar. And I know that many of you have already submitted questions, so we'll try and make sure that we address as many of those questions that have already been submitted. Now, with that said, let's get into tonight's presentation. America is going through a health crisis, and with the rising cost of health care and the turmoil going on in the health insurance industry, it's time to implement low-cost, natural, and preventative strategies that will significantly improve your overall health and wellness. This has the potential to reduce the devastating financial burden of Alzheimer's and other cardiovascular-related illnesses. Now, tonight we're talking about Alzheimer's and cognitive function. While I can't promise that if you follow the plan of action I'm going to outline in tonight's presentation, you will be free of this dreaded disease, I do believe I can help you to substantially reduce your risk. Not only can you lower your risk, but you can also empower others to lower theirs. According to the National Institute on Aging, about 5 million Americans have Alzheimer's disease. is the most common cause of dementia amongst older adults. Dementia is the loss of cognitive function, which includes thinking, remembering, and reasoning, to the extent that it interferes with your daily life and activities. One recent study from the World Health Organization warned that Alzheimer's could affect 100 million people worldwide by the year 2050. Now that's 39 years away, so you might think that it doesn't apply to you. Not until you consider the following statement from the National Institute on Aging. Although we still don't know what starts the Alzheimer's disease process, we do know that damage to the brain begins as many as 10 to 20 years before any problems are evident. It's for this very reason why prevention is so critical to your future cognitive health. If your age is 30 or 40 now, you will be age 70 or 80 by 2050. And since Alzheimer's disease is an irreversible, progressive brain disease that slowly destroys your memory and thinking skills, wouldn't it make sense now to take steps to prevent it from showing up during your later years in life? The health of your cardiovascular system is one of the keys to prevention. According to the Harvard School of Medicine, growing evidence supports a strong and likely causal association between cardiovascular disease and its risk factors, with incidence of cognitive decline and Alzheimer's disease. Individuals with subclinical cardiovascular disease are at higher risk for dementia and Alzheimer's. Several cardiovascular risk factors are also risk factors for dementia, including hypertension, high LDL cholesterol, low HDL cholesterol, and especially diabetes. The substantial overlap in risk factors points to new avenues for research and prevention. In your skull is a 3-pound wonder that has 100 billion neurons sending each other electrical and chemical signals in an orchestrated pattern that creates memories and allows for learning. At about the age of 30, our brain begins to shrink by about 0.5% per year. We usually don't notice this change for years, but over time this shrinkage, combined with other factors, begins to weaken the signals inside our brain. This leads to memory loss, which is normal for most people as they age. What is not normal is for this orchestrated electrical and chemical signaling pattern to become so dysfunctional that it leads to dementia, diseases like Alzheimer's. Each nerve cell communicates with many other neurons to form networks. These networks of neurons have special jobs. Some help us to see, hear, smell, move, and breathe. Other networks are involved in thinking, learning, and remembering. Every network of neurons is like a tiny factory that needs resources, generates energy, performs a function, and eliminates waste. To keep everything running in a coordinated operation requires large amounts of nutrients and oxygen. So of these 4 basic components, resources, energy, function, and waste, your cardiovascular system is critical to 3 of the 4 components. It's your cardiovascular system that will deliver the needed resources for brain function. Those resources, like oxygen and glucose, are going to provide the energy your brain needs to function. And the waste products created by your brain's energy production must be carried away by the circulatory system. If your circulation is compromised, then you will compromise brain function. They go hand in hand. It's also important to note that with the need for a large amount of oxygen, there is a tremendous potential for the production of free radicals. Now, free radicals are not the hippies from the 60s with the peace signs on their Berkeley t-shirts. Free radicals are a byproduct of aerobic respiration, energy production when oxygen is present. These free radicals are very unstable molecules and will steal electrons from other molecules to stabilize themselves. Without a good supply of antioxidants, these free radicals will steal the electrons from living tissue, which over time can damage the tissue, resulting in cell mutation, dysfunction, and/or death. Antioxidants are molecules that freely give away their outer electrons, and the neat thing about this process is that they are able to remain stable molecules. If a person's diet is lacking in antioxidants, then the protective role they play in preventing free radical damage is compromised. Vegetables, especially deeply colored vegetables, contain high concentrations of powerful antioxidants and have been shown to substantially reduce the potential for any type of dementia. Although there is no known cure for Alzheimer's disease, there is a growing body of work showing that if you take steps to prevent this disease, you can make a huge difference. And while we don't have time to look at all the information, let me point out several key pieces. Let's start with folate, or vitamin B9. Vitamin B9 is also called folic acid. It's essential for the creation of new cells in the body. Most people, especially women, associate folic acid with pregnancy to help ensure that the developing child will not experience certain brain and spinal cord defects. Right there is a huge clue. If folic acid is important for brain and nervous system development for an infant, why do we not recognize it as an important nutrient needed to continue to help the brain and nervous system operate properly as we age? Recent research is showing that a lack of folate, vitamin B9, may triple the risk of developing dementia in elderly people. Researchers in South Korea recently published their work in the British Medical Association's Journal of Neurology, Neurosurgery, and Psychiatry. After taking into account age, disability, alcohol consumption, and weight change, these researchers concluded the onset of dementia was significantly associated with an exaggerated decline in folate. Currently, the U.S. recommends a daily dose of 400 micrograms of folic acid. Unfortunately, most people do not obtain the current U.S. recommendation from their diet. To help highlight the powerful need for folic acid, I'd like to present the work of Dr. David Snowden from the University of Minnesota. In 1986, Dr. Snowden began a study with a group of nuns called the School Sisters of Notre Dame. This has now become a landmark study commonly referred to as the Nun Study. And one of the interesting findings was that nuns with high folic acid levels manifested hardly any Alzheimer's type damage to their brain in their autopsies. Dr. Snowden's explanation centers on folic acid acting as a check against the amino acid homocysteine, which has been implicated in cardiovascular disease. Higher levels of folate in the blood seems to offer protection against stroke and might even protect brain cells from damage. The next preventative nutrient is omega-3 fatty acids. In the world of fat, there are good and bad fats. Omega-3 fatty acids belong in the good fat category. A recent study conducted here in Chicago at Rush University Medical Center followed more than 3,000 men and women for 6 years. The researchers wanted to see how diet affected memory. Their study showed that people who ate fish at least once a week had a 10% slower decline in memory when compared to those who didn't eat fish. Some improvements, but it gets even better with the Framingham Heart Study. This famous and long-standing study showed that people who consumed the highest levels of omega-3 fatty acids had a 40 to 50% lower risk of developing Alzheimer's or any other type of dementia disease. So far we've seen how folic acid and omega-3 fatty acids have scientific studies to support their ability to prevent dementia. Our goal tonight is to give you a game plan for prevention. Now, according to Gary Null from his book Mind Power, contrary to mainstream medical belief, there are safe, natural, and non-toxic treatments for the symptoms of Alzheimer's disease. Research has demonstrated how these remedies can aid in preventing the onset of Alzheimer's or alleviating symptoms that have developed. In the past, Alzheimer's disease was considered an uncontrollable force that caused elderly patients to wither away and die. Taking action now can prevent our elder years from being characterized by cognitive degeneration and a rapid decline in health and ability. So let's look at iron. The mineral iron helps hemoglobin carry oxygen properly to the working cells to provide energy through aerobic respiration. Iron also helps the neurotransmitters that are essential for proper memory function. This means that low iron levels can have a significant impact in two aspects of brain function. First, it impacts the amount of oxygen the red blood cells can deliver. Since the brain uses a large amount of oxygen for energy production, a lack of iron will impact the amount of oxygen the red blood cells can deliver. Combine this with poor neurotransmission, and you have the potential for some significant cognitive impairment due to low iron levels. A normal blood test will tell you if you're anemic, but they will not tell you if your iron levels are low. So ask your doctor for a blood test that will check for your ferritin level, since this test will reveal even a moderate iron deficiency. One of the popular diets for weight loss has been the Mediterranean diet. It's important to note that the Mediterranean diet is a lifestyle of eating that has significant cardiovascular and cognitive benefits. The Mediterranean diet has long been shown to be a powerful factor in reducing cardiovascular risks. Now there is research showing that it will actually help Alzheimer's patients live longer. The study was published in Neurology and showed that those who adhered closest to a Mediterranean diet were at a 73% lower risk of death and lived nearly 4 years longer. According to the American Heart Association, the Mediterranean diet consists of a high intake of fruits, vegetables, breads, cereals, potatoes, beans, nuts, seeds, and olive oil. More than half of the fat calories come from monounsaturated fats such as olive oil. Dairy, fish, poultry, and other sources of saturated fats are eaten at low to moderate levels. I'd like to read the following statement. According to Dr. David Geldmacher from the October 2010 issue of the Cleveland Clinic Journal of Medicine, rates of dementia of all causes are higher in people with diabetes. And then he goes on to say, and this is what I have up on the screen, diabetes, hypertension, dyslipidemia, and obesity might lead to dementia in a process abetted by oxidative stress, endothelial dysfunction, insulin resistance, inflammation, adiposity, and subcortical vascular disease. All of these could be targeted for intervention to prevent and treat dementia. Now, I'll decode this statement in just a minute because it contains a hugely important key in helping to prevent cardiovascular and cognitive diseases that almost all physicians never ever consider. However, before I reveal this key, let me briefly look at exercise. We'll talk more in depth about exercise next week, but you need to know this about exercise and cognitive function. Exercise is important, but aerobic exercise is very important for both the heart and the brain. Researchers at the University of Illinois in Urbana put two groups of older adults on two different types of exercise programs. One group did 1 hour of aerobic training 3 times a week. Group 2 did non-aerobic stretching and toning exercises. MRIs were taken 3 months later. The aerobic group showed an increase in brain volume and white matter in the frontal lobes where attention and memory are processed. According to Dr. Arthur Kramer, the aerobic exercisers had brain volumes of people 2 to 3 years younger. Now let's go back and look at Dr. Geldmacher's statement. I put it on the screen and I've highlighted oxidative stress, endothelial dysfunction, and subcortical vascular disease. All 3 of these directly affect the most important organ of your entire cardiovascular system. You most likely thought that organ was your heart. The organ is your endothelium. In 1998, the Nobel Prize in Medicine was awarded to 3 American researchers who discovered how your endothelium produces a gas called nitric oxide from the amino acid L-arginine. And I would bet that many of you have never heard of this research or this organ, yet both have the potential to substantially reduce Some would even say eliminate cardiovascular disease, and by association substantially reduce the risk for Alzheimer's disease. Your endothelium is an organ. It's only one cell thick, and it lines all of your cardiovascular system, the inside of your heart, the inside of your arteries and arterioles, your venules and veins are lined by the endothelium. Your capillaries are just extensions of the endothelium. Scientists once thought that this was just scientists once thought that this was just an inner membrane whose only function was to keep your blood in the bloodstream. Now, research over the last 25 years has shown this organ to be a multifunctional organ involved in metabolic, immunological, and cardiovascular processes. Most vascular researchers today will tell you that your endothelium is critical to your cardiovascular health, and one of its functions is to produce a gas called nitric oxide, the master signaling molecule of your entire cardiovascular system. You could not live without nitric oxide. It keeps blood platelet cells from sticking together to prevent strokes and heart attacks. It's also your body's most powerful vasodilator, so it's critical in the regulation of your blood pressure. And nitric oxide helps keep the endothelium healthy and repaired. Your overall health truly centers on the health of your endothelium. Again, I placed Dr. Geldmacher's statement back on the screen. Diabetes directly damages the endothelium. High blood sugar causes oxidative stress to the endothelium. Hypertension or high blood pressure damages the endothelium. Dyslipidemia causes damage to the endothelium. Almost every one of the concerns pointed out by Dr. Geldmacher either directly or indirectly causes damage to the endothelium, reducing your body's ability to properly produce nitric oxide. So let's start pulling all the pieces together into a concise plan of action. The first step centers on repairing and nourishing your endothelial cells to improve their ability to properly produce nitric oxide, the master signaling molecule of your entire cardiovascular system. As we've already discussed, diabetes, high blood pressure, and high cholesterol levels all directly damage your endothelium. It's this cumulative damage over time that results in most cardiovascular diseases and is strongly associated with the development of Alzheimer's. Thus, your highest priority is to repair and nourish this organ to improve its ability to properly produce nitric oxide. Unfortunately, most physicians never ever consider this step. Thankfully, one has. His name is Dr. J. Joseph Prendergast, or Dr. Joe as he prefers to call himself. Dr. Joe has taken Nobel Prize-winning science and cutting-edge vascular research and put it into practical clinical application to benefit his patients. By properly combining 2 amino acids with several important vitamins and nutrients, Dr. Joe has been able to repair the endothelium and properly nourish it for improved nitric oxide production. This has resulted in phenomenal benefits to more than 7,000 of his patients. To properly implement step 1, you must consume 2 amino acids on a daily basis. The first amino acid is L-arginine. It's considered a semi-essential amino acid. This means that your body cannot produce enough of it by itself for optimal health. Thus, you need to get L-arginine from the foods you consume or from supplementation. And as you can see by the slide, I've listed some common food sources in which to obtain this essential amino acid. So let me make a few general comments. Most research indicates that for you to receive a therapeutic benefit from L-arginine, you need to consume at least 5 grams of this amino acid at one time. So when you examine the slide, you can see that the 3 best choices are beans, tuna, and chicken breast. 1 can of beans or 2 cans of tuna or almost 1 pound of chicken are needed on a daily basis. This quantity of food is necessary to have a significant therapeutic effect on your endothelial cells and their ability to properly produce nitric oxide. The other amino acid is L-citrulline. There's not much of a choice in food for this amino acid. Watermelon is your one and only good food choice, but unfortunately, 60% of the L-citrulline is contained in the rind portion, which most people never eat. You would have to eat over a pound of watermelon to get even close to the amount of L-citrulline your body would need for a therapeutic effect. Now, I need to make one more important point about these two amino acids. When I bring in a therapeutic level of L-arginine, 5 grams, it typically results in a 30-minute to 2-hour window of improved nitric oxide production. But when I combine the L-arginine with a therapeutic level of L-citrulline, you increase this therapeutic production of nitric oxide to a 24 to 36-hour window because L-citrulline will recycle L-arginine. This has huge health benefits, especially for repairing your endothelium. So step 1 is to effectively nourish your endothelium so that it can properly produce nitric oxide. And you can do this through your food choices, or you can do it through supplementation. Supplementation is usually easier and less expensive. And as Dr. Oz and others talk about L-arginine and nitric oxide, there are more and more supplements coming into the marketplace. Of all the supplements out there, many feel the best nitric oxide supplement is ProArgi-9 Plus from Synergy Worldwide, and I'll share with you why in just a little bit. But first, we need to complete our plan of action for prevention. So step 2 is to consume green vegetables. With the emphasis on climate change, there has been a big push to go green. Well, the same applies to your brain. You need to go green for improved brain health. Every study that incorporates green vegetables into a person's diet clearly shows an improvement in cognitive function. Green and darkly colored vegetables are critical components to help you prevent Alzheimer's disease and improve your overall health. So make it a goal to eat at least 1 serving of green vegetables at least 4 times per week. Step 3 is to make sure you consume at least 400 micrograms of folic acid on a daily basis. Proper levels of folic acid can reduce the potential of developing Alzheimer's disease by 40 to 50%. The 4th step in preventing Alzheimer's disease is to consume omega-3 fatty acids. The research clearly shows how important omega-3 fatty acids are for good brain health. If you're not into fish and you want to avoid the extra calories of other foods, then use a good omega-3 fatty acid supplement. Step 5 is to get a yearly physical. Make sure you pay particular attention to your blood pressure, cholesterol level, blood sugar level, and iron level. Ask your doctor for a blood test that will check your ferritin level because this test will reveal even a moderate iron deficiency. And step 6 is to exercise your brain. It doesn't matter whether it's physical or mental exercise, you need to exercise your brain. If you like physical exercise, then make sure that you have a good aerobic component to your exercise program. Your goal is to physically exercise at least 3 times per week, and it can be as simple as a walking program. As a standard note of precaution, you should always check with your physician before starting any exercise program. Now, 2 final thoughts. If you adopt a Mediterranean diet, you will cover steps 2 and 4, green vegetables and omega-3 fatty acids. If you utilize the nutritional supplement ProArgi-9 Plus, you will cover steps 1 and 3. This product includes therapeutic levels of L-arginine and L-citrulline with each serving. This product also includes 400 micrograms of folic acid and vitamin B12. A new study out of Stockholm, Sweden shows that vitamin B12 may protect against Alzheimer's disease. So here's your best plan of action. Take ProArgi-9 Plus on a daily basis, adopt a Mediterranean diet lifestyle, exercise at least 3 times per week, and get a yearly physical. This simple but highly effective plan of action will help improve your cardiovascular system and substantially reduce your risks for Alzheimer's disease. Now, we firmly believe the best L-arginine complexer in the marketplace is ProArginine Plus, which is manufactured by Nature's Sunshine Products and distributed by Synergy Worldwide. Nature's Sunshine Products is almost 40 years old. They are one of the most respected nutritional manufacturers in the world. In the last 15 years, they've been rated the #1 nutritional manufacturer in the world 3 times. So that's how good they are. Both Synergy and Nature's Sunshine has received the NSF Good Manufacturing Certification, which means that they meet the highest standards in the nutrition industry for quality assurance and control. The manufacturing process to create the proprietary formulation of ProArginine Plus is second to none. A total of 247 tests are conducted along the various stages of manufacturing to ensure the highest quality and potency of the ingredients used. And once a batch of ProArginine Plus has been produced, it must also pass through 15 additional tests before receiving its final stamp of approval. Now, this level of quality is also reflected in the people who are associated with this product. On the screen, I put up Dr. Prendergast again, considered by many to be the leading authority in the world on the use of L-arginine and L-citrulline therapy for the treatment of cardiovascular concerns. We've talked about Dr. Joe's pioneering approach to addressing the complications of diabetes in a previous webinar. Dr. Joe has been using L-arginine, L-citrulline therapy since 1991 to help his diabetic patients experience phenomenal results. And Dr. Joe contributed his 20 years of practical experience and research with the nutritional expertise of the scientists at Nature's Sunshine Products to develop the ProArginine Plus formulation, what many consider to be the best nitric oxide supplement in the marketplace. What also makes ProArginine Plus unique in the nutrition industry is that it has clinical application and studies to back up its effectiveness. The High Desert Heart Institute is located in Victorville, California. It's considered one of the premier heart institutes in the world. In late 2009, they did a human clinical study using ProArginine Plus. In fact, it's the most complete and comprehensive human clinical study ever done on a nutritional supplement. The study involved 33 congestive heart failure patients who were all medically and pharmaceutically managed to the maximum. Over a 90-day period, these patients were given an aggressive amount of ProArginine Plus. And by the end of 90 days, all the patients were either off of all medications or had their medications substantially reduced. Dr. Siva, who is the director and founder of the High Desert Heart Institute, made the following statement in a recent interview. What we ended up seeing was remarkable positive remodeling of the heart, positive pulmonary artery changes, pulmonary vascular changes in terms of pulmonary pressures, changes in the cardiac dimensions, changes in heart function. Because of these remarkable results to their patients, the High Desert Heart Institute now uses ProArginine Plus as part of their standard treatment program for their patients. Additionally, ProArginine Plus comes with a 90-day money-back guarantee, so when you factor in ingredients, price, quality assurance, clinical studies, and a money-back guarantee, ProArginine Plus has the best value and an extremely competitive price. So this leaves me with a final question. Do you want to combat the negative effects of premature cardiovascular aging, a factor that research is showing to be a real component in cognitive impairment? If your answer is yes, then please contact the person who invited you to the webinar, tonight's webinar. They can assist you in your purchase of ProArginine Plus and help you to properly start on this excellent product. It can become part of your health prevention action plan. Now, I'd like to turn over the rest of our time to your questions. Remember, you can submit them to Jean by typing them in the response box in the upper right-hand corner of your screen. So, Jean, do you have any questions from our audience? I know we had some questions submitted to us prior to the webinar.
Yeah, Dan, I was going to tell you that we've got quite a few questions tonight, so we're going to have to keep them as short as possible, but
okay.
hopefully you can get through them fast.
So you're telling me to be short on my answers?
Kind of.
Okay.
All right, first question. Can Alzheimer's be reversed?
All right. I do not know of any research out there that shows that Alzheimer's can be reversed, meaning taking a person from where they're at to being cured. But I can tell you that there are people who've seen significant improvements. I will give you one example. Here in Chicago, I have a client, Ernest Bug. His wife, Glenda, is a registered nurse. Ernest has vascular occlusion of the carotid arteries, and so he has dementia. Dementia where he was on significant medication. Ernest would sit in a chair, and you physically had to get into Ernest's face for him to begin to come out of his little world. And so he's been on Progyny Plus now for a little over 7 months. When you walk through the door now, Ernest will recognize you, get out of the chair, come shake your hand, give you a hug, engage you in conversation. You can see Ernest beginning processing thoughts. Ernest is not cured, but Glenda will tell you that she has never seen anything like it. And she actually has a husband who has a significant improvement in quality. He's not cured, but he has seen significant improvements in his dementia. Now, that dementia has not been classified as Alzheimer's, but it is dementia caused from vascular occlusion.
Dan, follow up to that question, how long did this take?
Well, so far, Ernest has been on the product for a little over 7 months. I'd have to go back and ask Glenda specifically, but if I remember correctly, Ernest began to see improvements in the first 30 to 60 day window. And so, you know, like I said, he's not cured, but he has made remarkable progress in terms of where he's at.
Okay, well, we have several people who would like to know, will this call be recorded, or will this webinar be recorded and archived for later?
If we're not able to do that on tonight's, because tonight's the first night that we've actually trying to record to see if we got our recording system down properly. But if it's not, we will make sure that we will record it in the future. One of our goals is to record these webinars so that they can be put onto a static web page that people can access, and then there'll be the webinars that we did on high blood pressure, cholesterol concerns, complications of diabetes, tonight's webinar, next week, so we'll have that whole package for people as well as we do additional topics in the future.
Okay, back to the can Alzheimer's be reversed? There's another question asked, how much proarginine was he on per day?
Well, okay. There's different philosophies in terms of how much Progyny Plus to use. Basically, it centers on an aggressive approach versus a conservative approach. I take a conservative approach. Many people use the approach that the High Desert Heart Institute used, which was 2 scoops in the morning, 2 scoops in the evening. That's a very aggressive program. And so when you start using that much product, for some people they're going to experience loose stools or diarrhea because there's xylitol as part of the flavoring system, because L-arginine by itself is nasty. No one would take L-arginine because it's terrible. It's hard to get down. So you have to flavor it, but you got to use a low glycemic flavoring system. So xylitol is used, but if you use too much xylitol, it can cause loose stools, diarrhea. So Synergy reduces the amount of xylitol and adds either sucralose in one formulation or stevia in a different formulation to be able to have that sweetness factor at a low glycemic delivery system. Now, with that said, I take a more conservative approach, and this is the one that I use with Ernest. A half a scoop for the first 3 days, and then on days 4, 5, and 6, they go to 1 scoop, which is considered to be the therapeutic level. It's where you get 5 grams of elemental pharmaceutical-grade L-arginine from a fermentation process, and the necessary L-citrulline, also from a fermentation process, pharmaceutical grade, pure form. And then what I usually recommend is that on day 7 they go to a scoop and a half if they've got health issues. I found from experience there's a significant difference in benefits between 1 scoop and a scoop and a half. Very little difference between a scoop and a half and 2. So I prefer to do the scoop and a half because I typically don't get the issue of loose stools and diarrhea when I'm at a scoop and a half. Sometimes it will occur, but usually for most people it doesn't. So I prefer to do the scoop and a half. And then if a person has a really significant health issue and they want to do more aggressive program, then I would recommend a scoop and a half twice a day as opposed to doing 2 scoops twice a day. That also gives them a balance between cost and effectiveness, and I'm always sensitive to people's pocketbook. So again, we want to be able to give them a product that can help them improve their health issues, yet at the same time be cost effective so that they continue to stay on it.
Okay, Dan, I have a question here that I'm not sure if you can answer or not. If you can't, I'll answer it. Can you email this presentation to anyone?
Most likely we could never email the presentation except through a Dropbox process, but once we have them recorded and hosted on a website page, then you would be able to have access to it that way.
That's what I thought. Okay, next question. Please address the effectiveness of L-arginine therapy in moderate to advanced cases. Also, effectiveness in prevention. I think you covered a lot of that.
Well, let me be really clear what ProArgi-9 Plus is designed to do. ProArgi-9 Plus is designed to nourish the endothelium with the amino acids and antioxidants and nutrients that the endothelium needs for proper production of nitric oxide. Now, we didn't talk about it in the slide presentation tonight. I've talked about it in a couple in the past, but vitamin D3 and vitamin K are extremely important for nitric oxide production because they regulate calcium in your body. Vitamin B3 helps to absorb calcium. Vitamin K2 helps to direct calcium in the proper places where it needs to go. Calcium is extremely important in nitric oxide production. Here's the best way I can explain it to you. If you walk into a dark room and you want the lights on, you flip the switch on the wall and the lights come on. So if you look at the light as nitric oxide, you look at the wiring system in the wall as the enzymes of the endothelium. If you look at electricity as L-arginine, the light switch is calcium. Calcium is what initiates the reaction so that if L-arginine is present, the endothelial cell enzymes can then convert that into nitric oxide. So what this product, ProArgi-9 Plus, does is it helps to nourish the endothelium so that it can properly produce nitric oxide. Now, when you get enough nitric oxide in your bloodstream, it's going to keep blood platelet cells from sticking together. That improves circulation because it prevents clot formations to prevent strokes and heart attacks. Nitric oxide relaxes the smooth muscle of the vascular wall to keep your blood pressure in a normal range. That improves circulation. And nitric oxide at sufficient levels in the bloodstream will repair damage done to the endothelium, and there's enough research out there showing that it will soften plaque formations to help the body to absorb those plaque formations through the vascular wall. They don't understand the full process of what goes on, but they know they can restore vascular the vascular lining back to a young, youthful stage. What all that means is that you improve circulation. So when I improve circulation, I improve the delivery of oxygen and nutrients to the working cells, tissues, and organs, and I remove waste products properly from those cells, tissues, and organs. We will talk about this specifically next week in our webinar on exercise, but I can show people how they can produce 18 times more energy by better delivering oxygen to the tissues, cells, and organs, and have waste products that are not detrimental to the body but actually beneficial to the body. And so all that means is that we improve the function of that organ. So when you improve the function of the organ, what happens? People feel better. They have higher levels of wellness, and many of their health issues begin to correct themselves because their organ is functioning properly. Your brain is no different.
Okay, Dan. I just want to remind everybody to type your question in on the panel. If you raise your hand, I'm not going to, I don't know what your question is, so if you can type in the question, then I can answer, I can repeat it to Dan. Dan, the next question is, they would like you to repeat the light bulb example.
Okay, the light bulb example. If you go into a dark room and you want lights on, you flip the switch on the wall. So if you look at your light as nitric oxide, the wiring in the wall as the enzymes of the endothelium that is used to create nitric oxide, the electricity as L-arginine, the light switch is calcium. You've got to have calcium to start the reaction. Okay?
Yeah, and the last question, if nobody else types in anything else, is how does Pro-Arginine Plus benefit the people who already have suffered a stroke?
All right. We talked about this in one of our previous webinars with regards to stroke. Now, if a person's had a stroke, then what we need to do is help them not have another stroke. If a person hasn't had a stroke, then we want to help them not have a stroke. So here are the two factors for most strokes. 87% of all strokes are due to a blood clot. And the number one risk factor for a stroke is high blood pressure. So let's go and look at what nitric oxide naturally does. Nitric oxide keeps blood platelet cells from grouping together to form a clot. So nitric oxide naturally prevents clot formation, so that reduces the number one cause of stroke. Nitric oxide relaxes the smooth muscle of the vascular wall to keep your blood pressure in a normal range. So nitric oxide directly addresses the number one risk factor for a stroke. So again, I'm not a physician. I can't make a recommendation to you, but I can tell you that the Pro-Arginine Plus is designed to help repair the endothelium. So if you look at endothelial cell health, most all cardiovascular issues are endothelial cell dysfunction. If you go on the American Heart Association's website, they'll clearly tell you that 74% of all atherosclerosis and arterial sclerosis, or I should say that 74% of all cardiovascular disease is centered around arterial sclerosis and atherosclerosis. Arterial sclerosis is hardening of the arteries. Atherosclerosis is plaque formations within the artery. And those are all endothelial cell dysfunctional issues. So again, if you can properly nourish the endothelium to improve its ability to produce nitric oxide, you can help to lower the risk of something like that happening again. Any other questions?
Yes, there are. Isn't nitric oxide a gas, so how can it help the L-arginine?
Okay, well, nitric oxide is a gas, and that's one of the reasons why people kind of poo-pooed Dr. Ignarro and the other researchers who won the Nobel Prize in this area, because in the environment, nitric oxide is a pollutant, but inside your body, it's used as a signaling molecule. It's only short-lived, and it's used to cause something else to occur. So that's why nitric oxide doesn't cause damage, although it can, to the body. If nitric oxide is produced in such high quantities, unregulated, it can cause a great deal of damage to the body. Your immune system actually uses nitric oxide to kill bacterial and viral infections. So again, your immune system will use nitric oxide to kill bacteria and viral infections, but again, it's getting your body in balance so it properly regulates this whole issue. So nitric oxide is extremely important, and many people confuse L-arginine and nitric oxide. L-arginine is an amino acid that the endothelial cells, through an enzymatic process, converts into nitric oxide. L-citrulline will then recycle that leftover L-arginine so that it can be used again so the endothelial cells can continue to produce nitric oxide. So again, when the Nobel Prize in 1998 was awarded, the research in this area exploded. There's well over 200,000 documented research papers in the area of L-arginine, nitric oxide, endothelial function. So it's just a huge area, and most people have never ever heard about this stuff.
Okay, Dan, another question, and then we have one more after this too.
All right.
I have 3 people that complain about upset stomach even with small amounts of Pro-Arginine. What causes this?
Well, most likely it's the xylitol that's in it. Some people are more sensitive to the xylitol. We're going to find out. We're going to conference on the 22nd of September. I don't know all the details. I know that they're coming out, I think, with a new flavoring system that takes xylitol out. I'm not sure on that. So when we come back, we have a webinar, a health webinar next Tuesday, and then we'll have a webinar after that. And when we come back, we might have some additional information that we can share with people on that health webinar.
Okay. Now, I know that we just did a webinar a couple Tuesdays ago, or maybe just last Tuesday on diabetes.
Yes.
But we do have a quick question on, and I don't know how short you can make this, but
Okay.
how does it help? How does it help diabetes?
Okay, two issues, blood sugar and damage. Proarginine Plus is not designed to regulate your blood sugar, although that may be a benefit or a side benefit that happens. You still need to do the things that you need to regulate your blood sugar. But high blood sugar levels causes oxidative stress or damage to the endothelium. It's that cumulative damage over time that causes most of the problems or complications that diabetics experience. Most all of those center around poor circulation. So, Proarginine Plus is designed to nourish the endothelium to help it properly produce nitric oxide, so the nitric oxide can then do the things that it is meant to do in your body. Keep blood platelet cells from sticking together to prevent strokes and heart attacks, relax the smooth muscle of your vascular wall to keep your blood pressure in a normal range, and repair damage done to the endothelium so that it can return it to a healthy state. Now, when you look at diabetics, 66% of diabetics have high blood pressure. So what does nitric oxide do? It directly addresses that issue. And a lot of diabetics have damage done to their vascular system. That's endothelial cell dysfunction. What does nitric oxide do when it's at proper levels in the bloodstream? It helps to heal that damage. So you can help that person to then improve blood flow. When you improve blood flow, you see an improvement in the person's circulation. One of the research studies that are being done right now at the High Desert Heart Institute is they're using Proarginine Plus in pre- and post-operative surgery to see what it does for wound healing, because one of the functions of the endothelial cells, or the endothelium, is angiogenesis, which is wound healing or the creation of capillary beds. And what they're finding is they're seeing significant improvements in wound healing, especially for diabetics. So again, don't look at this product as something that's going to regulate your blood sugar, although it can help do that. Look at this product as what's going to help to repair damage done to your endothelium by improving its ability to produce nitric oxide. That's what's going to help you begin to reduce yeah, I guess I'll use the word reduce, the complications that are associated with diabetes.
Okay,
Is that
Dan,
short enough?
we're really getting close on time, and we've got two more questions.
Okay.
Can we take two more questions?
Sure, not a problem.
Can proarginine help macular degeneration?
Well, again, I can't tell you of any specific studies in that area. I can give you, I can't remember the right word for this, but testimonials of people who have seen some things. I think Scott Norton's father would be a good one on that, but I don't know that story completely. But again, when you're looking at health of any tissue or organ, it all centers on circulation. So everything has capillaries to it. Capillaries are just extensions of the endothelium. So when you improve endothelial cell health and function, you're improving the function of capillaries. So when you do that, you can then improve blood flow to that organ and tissue, remove waste products properly, bring in oxygen nutrients properly, so you can help that organ to function better. So I don't know enough to be able to say to that person definitively in that area, but again, what we see from experience is that a lot of people see a lot of health issues improve, and it has everything to do with improved circulation.
Okay, Dan, I'm not really sure. There's a question about pomegranate and reaction with simvastatin?
Yeah, I don't know the answer to that. I know that the High Desert Heart Institute had no issues or concerns with any of the medications that they had their patients on, and these were highly medicated patients. In fact, the 33 congestive heart failure patients that were part of the study were pharmaceutically and medically managed to the maximum. That means that there wasn't any other medications that they could give to these patients to help them with their issues. And so they didn't have any problems using Progen Plus and had any concerns with regards to interference with medications that the patients were on. Most likely the best thing would be for that person to go contact their pharmacist, because pharmacists will typically know more about interactions than physicians will. So maybe they could go to their pharmacist and ask them that question specifically and have their pharmacist give them an answer to it.
Okay, Dan, I think that's the end of the questions.
Good questions. Thank you, everyone, for joining us on our webinar tonight. We hope the information was helpful to you. Again, I want to pull up one slide here before you leave, and you got to get out of my show here, and it'll just take me a second. But if you felt that this was valuable to you, and you feel that this would be valuable to other people, again, please make sure that you contact Jean at the email address that you see on the screen, and then she can put them into her master list so that we can notify people on the Tuesday nights when we do these health webinars. Again, they're designed to educate you, designed to give you information that goes beyond just Progen Plus. We firmly believe this is the best product out there for addressing endothelial cell health and function. But again, that is critical. You must address the health of your endothelium if you want to improve circulation. And that makes such a huge difference in people's ability to see improvements in their health. So we thank you for being on our call tonight. Contact Jean if you have other people that you think this would be valuable to them, and we'll make sure that we'll let you know, send you a link for next Tuesday's webinar where we're going to specifically address athletic performance. And so if you are an athlete, doesn't matter what level of athlete you are, or if you know of people who are athletic, make sure you get them on that webinar. They're going to get an eye-opener on how to take themselves to the next level. Thank you, everyone. Thanks, Jean.
Thank you, Dan. Good night.